Hey guys, so today was the ablation, and I've been home from the hospital for a few hours now. When I talked to my cardiologist's office, they told me that I should plan to stay overnight. They told me I'd probably get out at noon the next day. And this morning when I got to the hospital, they told me that there was a good chance that I would go home the same day. And if you're wondering, I learned that if the site that they need to ablate is on the right side of your heart, they typically are able to let you go same day. If they have to go over to the left, that's when they have to keep you overnight. Mine was on the right. And yeah, I just wanted to tell you a little bit about what happened today. I got a hotel in Milwaukee down the street from the hospital that I stayed at. And yeah, they have you stop your beta blocker at least a day before your surgery, which was uncomfortable. It was. I kind of felt up and down without it, and I found that Xanax and Klonopin agitate my SVTs, so as my anxiety set in, there was really nothing I could do. So I really didn't sleep last night. I literally woke up every 20 minutes, and this morning I freaked out bad. I was taking a shower, and it just every negative scenario possible, including death, was just. I mean, I literally was having trouble bringing a washcloth to my face. I just locked up, completely panicked, and didn't want to tell anybody. I didn't want anyone to know how freaked out I was, and and then when we were leaving the hotel, I came outside, and my friend, just her face was just completely, freaked out, and her truck died, and we had to get our truck jumped, and I was a half an hour late to the hospital, and I got there, and yeah, I asked to be brought back to my room by myself and left my family and friends. And when I was in this hallway back to the rooms, the nurse thought it was strange that I didn't want anybody with me, and I said, "Yeah, I'm kind of freaking out," and I didn't want anyone to know, and I just said I just wanted some time to gather myself. And she asked me if I wanted something to help settle my nerves, and I told her that benzos tend to agitate my SVTs, and I said I thought it was a bad idea, and I was just like, I can do this, I can really do it. So she brought me back to my room. They got me changed over into a gown, and my anxiety got worse and worse and worse and worse and worse. In fact, it got so bad that I literally couldn't read things. They gave me some information on the procedure, and I would look at the paper and just hand it off to somebody and ask them to read it to me. And then finally, a nurse came in and told me she had something for me that she wanted me to take before the procedure. And I said, "What is it?" And they told me they give patients Ativan as a pre-surgery thing. And I told her, I was just well, it's going to flare up my SVTs. And she said, "Good, because they're trying to catch them, during the procedure anyway." I was just yeah, I guess that's true. And I thought, it might help me a little bit or whatever. Take the Ativan. Take the Ativan. I mean, 20 minutes after I had it, I felt very, very sober-minded. I felt like I was completely there still. I didn't feel stoned at all. I just completely relaxed. Totally relaxed. I had that very distinct, everything's going to be just fine feeling. And I started to remember why we were there and how positive this all was. And I was finally going to get my life back and all this kind of stuff. And I just, everything took on a new light. And one of the operating assistants, and I'm sorry, I don't know what his term was or title was, came in, told me a bit about the procedure. The anesthesiologist came in. They were more than happy to answer all of my questions, my family's questions. I had a whole entourage with me, and I walked myself down, to the operating room, and I'd already had an IV put into my arm. And when we got in there, they had me sit up on a table, and the anesthesiologist connected an IV bag to the IV in my arm. And the guys are talking to me, and I have a lot of tattoos, and they're asking me some questions about them. And I got that cold trickle of the IV start, And a minute or two after that, I was talking to a guy, and then I started feeling really kind of tired. But I thought, you know, I didn't really sleep the night before, and I haven't eaten in like a day and a half, and I was just like, you know, that's probably it. And then I was like, wait a minute, and I looked at the guy, and I was just like, you already started the drugs, didn't you? And he's like, yeah, we did. That's it. That's all I remember. I was out cold. Apparently they woke me up a bunch of times, asked me questions. They had to bring my heart way up to try to catch the SVT on, you know, their machines to correct my problem, which incidentally, they never caught mine. And I don't know if this has happened to anyone else. They told me they were not able to get me to produce the arrhythmia, but the cardiologist told me that she saw an irregularity in my heart, like a physical thing that she was able to alter, and she told me with 80% certainty that was absolutely what the problem was. And yeah, I woke up in the patient recovery room. I felt completely okay. Like, I wasn't foggy, I wasn't you know, struggling to wake up or anything like that. I just kind of woke up, and all my friends and family were there, and everybody was smiling, and it was all over. It was such a relief. And as soon as I woke up, I was like, I'm totally okay. And again, like, some people talked about having a burning in their chest. They talk about like pressure. They talk about hard to breathe, all this kind of stuff. Absolutely none of that. I had no pain at all, no memory of the procedure. I didn't wake up a single time. Nothing happened. And yeah, like when I would kind of move, I was absolutely still under the medication, and in fact I still am a little bit. And it's 9 o'clock at night now, and I was done with my procedure a little bit before 1, so it still hangs on a bit, but there's nothing unsettling about it. It just feels like you're kind of sleepy, and like you just woke up, and you feel absolutely 100% okay. You're not alarmed in the least. And they informed me that I'd be going home that day, which was a big surprise to me. And in fact, they're like, yeah, we're gonna kind of, you know, walk you around in a bit, and we'll get you out of here in a couple hours. And I was just like, you kidding me? Like, that's it? And that was it. And got out of there, and I'm talking about, we went shopping, you know, which is probably the stupidest thing you could possibly do, but I did. And I'm standing in a Walmart buying soda for dinner, and I'm looking around, and I'm like, these people have no idea that I just had heart surgery, and I'm okay. And it was just like, it's the most surreal feeling in the world. And if you can get anything out of this, I hope it's just like absolute relief. These people, I mean, they must see people with so much anxiety and so much concern and all this kind of stuff every single day. They're there with you every single step of the way. I was concerned that I hadn't actually talked to my doctor very much that was going to be performing the surgery. I knew that she had done tons and tons and tons of them, and I knew that she was well regarded for her practice. But I was concerned that, you know, she hadn't really spent a lot of time talking to me. But the reality is, most of your time is going to be spent with nurses, and the nurses that I had were so nice. My anesthesiologist was a very, very, very nice guy. He was very in tune with me and my comfort level. Yeah, it couldn't have gone better. It couldn't have possibly gone better. And I'll tell you something else. You know, I've seen other people that have had to have like second ablations. Some people have had 3 ablations. If we had to go back again tomorrow, I wouldn't be scared at all. It is so simple. When I got my wisdom teeth taken out in high school, that was way worse than this was. I mean, I was groggy, and it took me forever to come out of that anesthesia. This was nothing. The only complaint I have in the world, the only one, they did have to put me down pretty deep at one point, I guess, and they put some kind of a breathing tube in for me, and I woke up with an awful sore throat, and they were giving me lozenges, and I still have that sore throat a bit, but it feels like I slept in a really, really, really dry room in the middle of winter, and it's that like really, really dry feeling. It's not like a sharp, like stinging pain or anything. It's just like, you'd swear to God you just slept in a dry room. It's nothing to worry about. They had to go into both of the veins in my legs. I guess for some people they're able to do just one. They did have to do both for me. And honestly, most of what I'm feeling is the tape around. They have these big like cotton pads, you know, over where the veins, you know, the incisions went in. And most of what I'm feeling is just a pulling of the tape. Like there's no like real pain there or anything like that. And again, I just can't stress enough. Nothing to worry about. Don't worry about a thing. It's so simple. You go in, they take great care of you. You will not remember a thing. You won't feel a thing. Just, if I can help anybody feel better about this, I'm glad, because, you know, I'm so glad that it's over. So, anyway, I'm going to do another follow-up video. I have to go into my cardiologist's office in 2 days. She wants me taking the beta blocker again until I see her, but I'm hoping that they're going to discontinue it at that point. I'll let you guys know how that goes. I'm going to let you know it comes up. And the last thing I want to mention, the way my SVTs were, I would get like these, like it would feel like my heart would kind of like bulb up, like it would kind of like bloop, 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 and then the SVTs would start. Like I would feel it kind of swell and then go. I've had like a couple of these little, I'm calling them like ghost flares, like I'll get that little push, but then there's no SVT behind it. Like I get the little push feeling in my heart, but then there's no erratic beating, there's no shortness of breath, there's no nothing. And like I take these deep breaths and I get no heart flutter behind it, and like I am completely starting to appreciate how screwed up my heart was, and I never knew. So I'm telling you, go in confident. They're going to take great care of you. Take the medication that they offer you. That Ativan is a freaking lifesaver. You're going to be just fine. So anyway, I wish all of you the best of luck. I'll be back for my follow-up video. And I hope you guys have a great surgery.